Welcome back to part 3. So now we're going to look at bone fractures and how fractures heal. So a bone break is a fracture, or a fracture is a break in the bone. Um, Two major types of fractures would be closed or simple fractures, or open compound fractures. A simple fracture is one that does not, where the bone doesn't penetrate the skin, and typically they heal much faster. Compound fractures occur when bone actually penetrates through the skin. Okay, there we go. So typical healing time for fractures will be 6 to 8 weeks, depending on if it is a simple or a compound fracture. Closed reduction occurs when the physician just moves the bone by hand, puts it back in place, and then puts a cast around the bone. An open reduction occurs when you have to actually have the bones, you have to have surgery to move the bones back in place, and they're held together by pins or wires. That takes longer to repair. So repair of fractures has 4 major steps: hematoma, fibrocartilage callus, bony callus, and then bone remodeling. I'm going to go to the next page and show you those. So a fracture hematoma is the first step, and basically a hematoma is just a large blood clot that occurs around that broken area. So remember, I told you that bone is highly vascular, it's living tissue, and if you've ever broken a bone, you know that there's blood as well as nerves that run through bone. That swelling occurs because the blood vessels are damaged, and so you have a lot of blood flowing to that area. The blood flowing to the area forms the swelling, and swelling actually helps to immobilize that region as well as helps to bring the different blood cells that we need to clean up that area. So that hematoma is the first thing that's going to happen. And then a fibrocartilage callus is formed. The fibrocartilage callus forms while blood vessels are repairing themselves. Remember, fibrocartilage is avascular, so it doesn't need the blood to feed it. It gets its nutrients from diffusion surrounding the area. So the fibrocartilage callus forms, helping to hold the bones together. Then we have bony callus that replaces the fibrocartilage callus. And a bony callus is kind of, it's a spongy bone that replaces the cartilage. As the blood vessels repair themselves, bone forming cells can come in and break down the fibrocartilage, and then they move in, forming that bony callus, which then is replaced by bone remodeling by compact bone in the areas that we need the compact bone. And osteoclast will break down the spongy bone, osteoblast will form compact bone, and then we have a stronger bone in that area where we had the damage. So what are some common types of fractures? A comminuted fracture is one that breaks in multiple places. This is typically seen in individuals that have weak bones, so older people, if you have osteoporosis, or if you don't use your bones a lot. Compression fractures are fractures where the bone gets crushed. Again, this is often seen in older people, osteoporotic bone. Depressed fractures are often seen in as skull fractures, when some very blunt, heavy instrument crashes into the skull and the bone is depressed into the brain. Impacted fractures occur when the bone ends are forced together. So you see this a lot of times if people are falling and they try to catch themselves, or if they are jumping off of something that's too high and they shouldn't have, that could cause an impacted fracture as well. Spiral fractures occur when you have excessive twisting forces on the bone. So you see these in like sports injuries. So think about like if someone is trying to move in football and someone else goes to tackle them and their leg is still twisting, but they can't move the actual leg itself. So the bone moves and it's twists, the twisting actually breaks the bone. That would be a spiral fracture. And then probably the most common fracture in children is a green stick fracture, where you have a partial break in a bone, but it only breaks one side, not the other side. So how many bones do we have? In general, humans have approximately 206 bones. This number will vary depending on any surgical procedures you might have had, as well as the more work you do with certain parts of your body, like your hands or feet, you may form new bones within the ligaments of those bones and tendons. So we have 80 axial bones, and those bones form the axial region. So the axial region right here is the skull, vertebrae, the ribs, sternum, all the way down to the sacrum and coccyx. So this shows your axial region in green on both sides, anterior and posterior aspect. So concept link, learn. Many of these terms are associated with the bone names. So you know the regional body terms, then you should be able to get those bone names much easier. So when we look at the skull itself, we have cranial bones and then facial bones. And in general, most of the bones are joined together by a joint called a suture. A suture is a dense, regular, fibrous connective tissue that holds the bones together, and it is an immovable joint. The only bone that is movable in the head or the skull is the mandible, and that is a freely movable joint. So there are 8 cranial bones and that protect our brain. So we have a frontal, occipital, ethmoid, sphenoid. We have 2 parietal bones and 2 temporal bones. Then facial bones, we have a maxilla. So there are 2, one on each side. Palatine bones, lacrimal bones, zygomatic bones, nasal bones. We only have 1 vomer. And then inferior nasal conch, which there's 2, and then the mandible. So here you can see the different sutures really well. This is showing a squamous suture, a lambdoid suture, a coronal suture. There's actually another suture that runs along this way called a sagittal suture. And you can also see the bones. So here's the frontal bone, parietal bone, temporal bone, occipital bone, mandible, zygomatic bone, maxilla, nasal bone. And then there are certain markings that you can also see, external acoustic meatus. So that's the external ear area. So this is where sound waves move into the internal region of the body, or into the temporal bone. This is a superior view of, so if we were to cut the top of the cranium off, so that would be a transverse cut. Now we're looking down, so this is looking down at like superiorly looking down. You can see the ethmoid bone here. Again, you can see the frontal bone. This large butterfly-shaped bone is called the sphenoid bone. There's your temporal bone, your occipital bone, and this little bit of green, that's your parietal bone. Right here, this region here of the sphenoid bone called the sella turcica. Sella turcica is where the pituitary gland sits. Here you can see little tiny canals where your optic nerve runs through. And here's a jugular foramen, and that's for your jugular vein. So this is an inferior view. If we were to take the skull and just look at the bottom part, take the mandible off, now we see the maxilla again, right here. Here we have the palatine bone. This is the vomer. You can see it under here. You can also see it on an anterior view of the skull. Right here you have your sphenoid bone. They always try to color them the same to make it easy to understand. Occipital, temporal. You can see a little bit of the parietal bone. But other things you can see here is you see this mandibular fossa. Remember, a fossa is a smooth depression where bones articulate. So right here is where the mandible articulates with the temporal bone. Here's an occipital condyle. This is where the first vertebrae, the atlas, articulates with the skull. And this large foramen magnum, that's actually where the spinal cord leaves the brain and leaves that skull, protrudes through and into the vertebral canal. Here's an anterior view, so looking straight on. Here is that vomer. I said you could see it before. And here you have the inferior nasal conch. Up here, this is the ethmoid bone. It actually moves down into the nasal cavity. Ethmoid and the vomer are what make up your part of your nasal septum. This bone here is called the lacrimal bone, this little green one, and that's where we have a little tear duct that, or a tear canal, I should say, lacrimal canal, where tears that are produced more on the lateral side of the superior eye form, they drain through here and end up in our throat. So our eyes, our nose, our ears all connect to our throat. And so if you've ever had a runny nose because you're crying, it's because you're producing a lot of tears, and those tears are moving so fast that they end up in your nasal cavity. Also, if you've ever had a cold and your nasal cavity is really, really plugged up, sometimes that causes tears to fall out of your eyes because they can't go down the lacrimal canal. Kind of interesting, right? And of course, you can see these other bones again. We have the zygomatic, we have the sphenoid, we have the frontal, the parietal, we have a little bit of the occipital, or the temporal, I'm sorry, mandible, maxilla, and nasal. Oh, and down here you can see the parietal. And here's that sagittal suture I was talking about. Sinuses. So sinuses are hollow regions within specific bones. They are named for the bones that they're found in. So you can see a frontal, ethmoid, sphenoidal, and maxillary sinuses. Their job is to lighten your skull. So your skull would be really heavy without these sinuses, and we wouldn't be able to hold our head up as effectively. It also helps us to amplify speech, so we can push our voice out further. Here's a side view. So you can see these same, we're only looking at one here, but we actually have paired sinuses. The hyoid bone. This is the only bone of the body that does not articulate with any other bone. It sits there, it doesn't touch any other bone. It is the bone that is used to attach our tongue muscles, helps us with swallowing, aids in speech, and it is typically the bone that if someone gets strangled, that's one of the bones that the forensic pathologist will look for to see if it's broken, because if it's broken, that's a sign of strangulation. Piece of interesting information. I watch a lot of those, you know, crazy law shows where you see stuff like that. So the next region of the skeleton, then, of the axial skeleton, is the vertebral region. The vertebral region extends from the skull to the pelvis. There are 26 bones. These vertebrae are separated by structures called intervertebral discs, which are composed of fibrocartilage. Intervertebral discs help to decrease compression, so they kind of take some of that pressure off when our body is bouncing and the vertebrae are trying to hit each other. There are 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae. When we talk about them, I usually remind people that we eat breakfast at 7, lunch at noon, and dinner at 5, and that helps you remember the number of those vertebrae. Then we have a sacrum, which is a large structure formed by the fusion of 5 vertebrae. And then a coccyx, which is the tailbone, which is formed by the fusion of between 3 and 5 vertebrae. So here's that structure. We have cervical vertebrae up here. Then we have the thoracic vertebrae. And then we go down to the lumbar vertebrae, sacrum, and coccyx. And you can see those curvatures. These are typical curvatures that help us to maintain posture. The top 2 vertebrae are really important. They're called the atlas and the axis. The atlas, I always think of the atlas as the atlas book holds the world. The atlas vertebrae holds our skull. And then the axis, the atlas, or the world, spins on its axis. So the atlas can spin on its axis as well. That's how I always remember them. So we start out with certain curvatures, primary curvatures. Our vertebrae have more of a C-shaped structure when we're born. But as we start moving our head, holding our head up high, crawling, walking, secondary curvatures form, and that's what forms that S-shaped structure of the vertebral column in adults. So there's that C-shaped curvature in an infant, a newborn. I'm going to stop here. I know this is in the middle of vertebral column, but I've already talked for 18 minutes and I don't want this to get too long. So I'll stop and I'll start the next one in our next video. Bye.